So for now, supplies are really running out. From what I've heard, from what I know, there hasn't been any supply going in to Mariupol from what I've heard, and so the supplies people have are the supplies they've been rationing now for over a week, and there is no water in the city. So people have been collecting rainwater, people have been collecting snow, and people have even broken into their own heating systems in order to access the water in the heating systems. This is how dire the situation is.
What's the situation at the hospitals in Mariupol? Are they in operations?
In Mariupol and around, there are, I believe it's around four or five different hospitals which have capacity for surgery, emergency rooms to receive inpatients. And we've been working with these hospitals, we've been in touch with these hospitals, but now for over a week, we unfortunately lost contact because communication is no longer possible. So the last communications we had were them telling us, confirming that they were receiving wounded into the hospital and that they were treating the wounded, but that they were concerned that they were going to run out of supplies of essential medicines and essential medical supplies in order to treat the wounded. But we can assume that resupplying these hospitals will be a top priority should some sort of safe passage open up. As of today, it hasn't yet happened for Mariupol. When we could still communicate with our staff, we would try to give them information if we heard one might be happening. They would confirm for us that they weren't able to leave. There were a couple days where there were rumors going around the city that a corridor would be opened, and so people were packing their cars, people were getting ready, only to find out at the end of the day that it wasn't yet safe because there was still fighting, and so there wasn't a safe passage, which of course has a huge effect on people's sort of mental conditions when they have the hope of being able to leave and then yet again are having to stay in these conditions. But it's also important to know that many people will choose to stay. Some people don't wish to leave their homes. Some people can't leave because they have chronic conditions or are unable, don't have access to transport, have nowhere else to go. And so many people will choose to stay, which is why it's absolutely essential, should safe passage open, that supplies are also brought into the city. And we just need to insist on all sides that it is incredibly urgent to find a solution. Whatever that solution is, people need to be safe. People have the right to seek shelter and seek a safe location, and we need to insist that we find solutions today.